I'm Rebecca Gordon.
I'm Sylvia Gordon.
And we're going to talk about VBC.
Value-based care. If you went to any of the carrier rollouts, they all talked about how much of their population is in value-based care and what their goal is to increase value-based care, and CMS's goal for 2030 on value-based care. What is value-based care?
What does it mean?
Of all the rollouts we went to, not one person said what it was. But we know there are more players in the value-based care market. The first big one
was Oak Street, and it was really cool because several years ago I toured one, and their model blew me away. So it makes sense other people are following the model. Value-based care is healthcare focused on quality, not quantity. And they are typically positioning these in the underserved markets, the dual markets.
Well, they're putting them in the dual markets, not just because there's a need for the service. It's because they get a lot more money.
On average, the insurance company makes 19% more on the dual population. So it makes sense that all the carriers, everything that is happening in the advantage market, the focus is on the dual side.
Right.
So we see this value-based care fitting beautifully there because our duals tend to have the highest claims.
So we said
cost much.
We said value-based care is quality over quantity. So can you explain that better?
So a lot of times when you go into your doctor, the doctor gets paid per service or for a reason why you're there. You have a sore throat. I need to look at your bunions. Maybe your knee hurts. So those are three. It's just checking the box. And there's no benefit for that doctor actually making me better. Value-based care is the doctor makes the money, a lot of money, by seeing me for everything and improving my quality. It's kind of like a report card. It's like they're getting, a lot of kids will get a bonus at the end of the year for their report card for all A's. That's what value-based care is. If they can improve the quality of their book of business, they make more money.
So they're paid more based on outcomes. So the outcome meaning you didn't have an inpatient stay. You didn't go to the ER. Those are the two big ones. Keep you out of the ER, keep you out of an inpatient stay. And so I've had people complain. They're like, they're very aggressive. Like they're always calling me and emailing me and they're inviting me to picnics and stuff. They're very high touch because they want to make sure if you're diabetic, that you're not ending up with a sore that progresses to an amputation, that they want to give you the mirror so you can see your feet. They want to schedule your checkup. Oh, you didn't make your checkup. Why not? Oh, my car's broken. We will come pick you up. We will bring you to the checkup.
Which is really cool, especially in the indie market. You'll see, I think that the Oak Street, their cars are green or their minivans. So you see them around picking people up, taking them to their appointment, and their appointments are longer.
Well, I toured a facility in Philly in a very, very impoverished neighborhood, and it was lavish.
They are lavish,
and they love on you. They were so friendly and kind and helpful and patient, like everything the opposite of normal health care.
Well, and a lot of them all have community centers. So
right,
they are playing bingo. They're bringing their people in.
Yeah, they have a lot of stuff because they want to get, especially this population that has the most chronic disease and has the most headwinds to get care, to really feel like they have a home and that somebody cares and helps coordinate their care. So it's a beautiful concept. Yeah, it's a cool concept. It's completely different. So the regular fee for service is what you call regular Medicare. It's fee for service. I get paid a fee for every service I do. Regardless if I'm a good doctor, a bad doctor,
I get better. Oh, yeah.
So CMS wants to transition everybody to value-based care. Be a good doctor and we'll pay you more.
I would love that.
Be a worse doctor and you're going to have some downside risks. So not all the contracts with these value-based care with all the insurance companies and these standard clinics, they're all different. We're not privy to that. But the most lucrative ones have downside too.
So if you don't perform, you don't get paid.
And that's why you're like, why are they so aggressively wanting me to get my colonoscopy? I'm like, I don't really like a colonoscopy. I had somebody tell me last week, I had one 7 years ago and they took out 2 polyps. And I'm thinking, why don't you want to do your 3-year checkup? You know? Like, why? And they're like, and I just don't want to. And they keep calling me because they don't want you to get colorectal cancer. Like, they're not harassing you.
Right.
And if they can prevent you from getting that cancer, which a colonoscopy can
This would
prevent,
be a good thing.
they will reap some upside benefit. I think value-based care is awesome. I don't think there's any detractors right now.
There's none.
But I will tell you who's really, really interested in it.
Those private equity investors, they can smell opportunity. In fact, they're up 39%
Yeah, so they
in investments in these.
in the last 12 months.
That's
Private
pretty.
equity was like, yeah, we want a piece of that.
It,
So you will see more of these clinics, more of these.
and if you can, I mean, go tour them. They will knock your socks off how absolutely gorgeous they are.
One of the things that was interesting this year was one of the companies was giving agents, because there's no upside here for agents we're the ones that are pushing them to get their health screenings, right? There's no upside for us. Somebody has suggested that. But one of the companies this year said if you schedule a primary care appointment with one of our value-based care new clinics, we'll give you an agent $150. I was like, whoa, where'd that come from? But that's to try to introduce these clinics and this whole new concept to the public to try to enlist agents and get our help, which I highly encourage.
Was that customer going to remain the agents, or is it just a
Yeah.
referral fee?
No, still the agent.
Because
Just to introduce them to these clinics. So now you know
Check
about
'em out.
value-based care and
Very cool.
why it's so important to CMS and all the insurance carriers and to private equity.
Good selling, folks. Thanks for tuning in.